Anabolic steroids are synthetic drugs that produce the male sex hormone testosterone. They are most commonly taken through injection with a needle or taken orally. Steroids were originally created to treat diseases such as muscular dystrophy, however, are also now commonly used by athletes for the competitive edge they believe it gives them. The testosterone increase in the body from the use of steroids promotes muscle and weight gain and an increase of aggressiveness. The constantly increasing competitiveness amongst athletes of all sports can lead to a willingness to do anything to gain an edge on their opponents, and steroids, to many, seem the most attractive way to get ahead. But the question is, how dangerous are steroids? No doctor will prescribe anabolic steroids to an athlete simply for muscle gains, which leads to the consumption of the drug without consent from a professional in the medicinal field. Often, this lack of guidance leads to a process known as stacking, in which several variants of steroids are consumed, which can result in the athlete using 1 to 100 times the usually prescribed amount. The overuse of the drugs have shown several common side effects, including severe acne, high blood cholesterol levels, and a high blood pressure. Other physical side effects include a loss in sex drive, mood swings, and extreme irritability.
Number 2 is the mental addiction associated with testosterone use. Obviously, when you're taking this stuff, you're growing muscle really quick. You're getting stronger at a rate that you've never experienced before. And this really messes you up, psychologically. So eventually, you're going to be cycling on this stuff for 8 to 12 weeks or whatever kind of crazy cycle you do. You're going to have to cycle off at some point. When you cycle off, your gains are going to go down the drain. You guys are going to lose muscle mass. You're going to lose strength. And you're kind of always chasing that high like a drug dealer, like someone who does cocaine, or someone who is an alcoholic, or just any kind of drug addict. They take that drug to chase that high, that feeling that they get, when they're on the substance. And, this can become really ugly, and that's why steroid abuse and steroid addiction is treated really, really seriously, just like a cocaine or a heroin or an alcohol addict.
Though anabolic steroids have not been put into the category of synthetic drugs that are considered addictive, they have been known to have addiction-like side effects. When an individual discontinues the use of anabolic steroids, they have addiction-like symptoms, such as depression, anxiety, loss of sleep, and a craving for the drug. Thank you for watching my video on anabolic steroids. Don't do them.